foundation issue, and it's not just about recovery from mistakes when you're young. You should start doing this when you're young and old and everything in between. It's pretty straightforward, it's not that expensive. Moisturize, you're not gonna moisturize, frankly, it's not worth doing anything else. But you have to moisturize everything you wanna keep young, including your neck. I'm always amazed when women moisturize to their chin line. And then do face lifts, everything down there. You gotta do the whole thing. Chin, neck, hands, everything you wanna look young. Everyone's going like this down. They're trying to smear it off their face to their neck. Go home today, get more moisturizer and put it down there. You want to exfoliate weekly. You want to use the most powerful over-the-counter retinols, because they're inexpensive, that you can get. And just dab them on behind your ears, sensitive skin. Just make sure they're not going to irritate your skin. And then try to use them at least once a week. You can do it more. I think you should do it more than that. Probably every other day. But you build up to it. It makes your skin, it forces the skin to make new cells. So you want that to make your skin look younger automatically. You obviously need sunblock. I happen to prefer the mechanical sunblocks. Zinc and titanium dioxide. They tend to immediately work, and they don't get metabolized inside the skin. So I think they're a little better solution for people who have allergies to these different chemicals. And if your sugar levels are high, if your blood sugar levels are running high, your skin will turn yellowish. And you'll look sour, bilious. You don't want that. So make sure you're keeping your blood sugar levels low and you won't get the skin cracking. High blood pressure also cracks the skin. It makes the skin the blood vessels in the skin very friable, so you end up without enough blood supply in your skin. So these are things to be thoughtful about for chronic conditions. The reason we pay attention to beauty, the reason you all care about looking young on the outside, is because within a second, you can process if someone's healthy or not. I can look at you right now and say, you know what? You're attractive, therefore you're healthy. Why? Because healthy people are represented first on the quality of their skin. It doesn't matter what size of brow you have or what color hair you have. Those are subjective, smaller things. The number one thing we look for is the quality of skin in somebody else. So if your insides are healthy, your skin will reflect it. So be healthy on the inside and it will happen. That barometer of health will be reflected appropriately. And then the little tricks I gave you will help as well. Otherwise, you look like this. And you won't be happy about it. You'll be complaining and moaning and groaning all the time. All right, now I mentioned to you we're doing a 1,000th show. And we're going to, for World Health Day, tackle a couple topics that are ones we could never have talked about 7 years ago when we started. We never have discussed it. The first one, medical marijuana. We already in medicine, we're talking about, personally, I never smoked pot. I'm a control freak. I wouldn't want to be out of my space. But that's just me as a personal belief about my own life. But as a doctor, I have to endorse medical marijuana. And I've had many people on the show. Montel Williams, who I just adore. Montel was a U.S. Marine. Marines are always Marines. He is a U.S. Marine. Risked his life for our country, developed multiple sclerosis, and then was told by our government that he could not treat his pain from his MS with pot. And it infuriates him, because medicinal pot actually works for that, for chronic pain. It's probably better than opiates. You know, the classic drug addict in America is a 35-year-old employed person who hurts their back. They get put on OxyContin or Vicodin for 2 weeks, and then they get hooked. And then they don't know what to do, so they try to, the Vicodin is really expensive. So heroin's cheap. They start slowly moving their way to heroin, and the next thing you know, they're a drug addict. They didn't want to be a drug addict. You don't get addicted to pot. And we had a show last week that we did on this topic, and I was surprised to learn how much drug enforcement people were saying that pot's a better choice. Because people aren't going to go off the deep end on pot. They do go off the deep end on opiates when they can't get enough. So for pain management, like for MS, for chronic conditions, for problems with appetite, with chemotherapy, and tolerating the fears, these are places where medical marijuana works. So I think the answer to this question is, I like medical marijuana. Here's the catch. Medical marijuana is for medical conditions. A little anxious is not a medical condition. You know, a mild sensation of dis-ease is not a medical condition. That's life. Life's messy. So we got to be able to cope with those issues without resorting to pot. But when used appropriately, it works. Now here's the challenge in America. In California, I can literally write pot on the back of a napkin and you can get it. Literally. I live in New Jersey. I would take the show in Manhattan. In New Jersey, it is legal for me to prescribe pot to you. It's illegal for you to buy it. So that literally we have people with prescriptions going to dealers to try to get pot. Now that's slowly changing, but we as a country, all of us need to get together and say, guys, it's done. Medical marijuana works. The whole issue of pot has been overblown. We gotta be careful with kids. You gotta be super suspicious of people using it for quality of life only, but for people who want to use it for major medical problems, let them have it. How about this idea, right to die? We had Brittany Menard's mom on the show. It was one of the most compelling interviews that I've ever been involved in. We did it last month. And remember, now her daughter, Brittany Menard, was 29 years old, diagnosed with brain cancer. And she knew she had no chance of surviving. So she wanted to be allowed to end her life. That's not a rare scenario. And her thought was, I don't want to be drooling in a bed like this, seizing as I die. I want to control my end and live with dignity and know what's going to happen. So she moved to Oregon. And she was able to accomplish her goal. The day that she decided she was going to take her life, she took the pills. But you have to swallow the pills. No one can give you an injection. You have to actually take the pills yourself. You can't swallow, you can't do it. So she did it. And when I asked her mom about this, I said, well, what about people who say that that's suicide? That you shouldn't be doing that. And she said, you know, I understand and I'm respectful of that, but my daughter's life was taken from her by this diagnosis. It wasn't taken from her because she wanted to die. There's a big difference. Think of it this way. Suicide is a permanent solution to a short-term problem. Most people who commit suicide are really depressed for 36 hours. They come out of it again, they won't hurt themselves. Assisted right to die laws are a quick solution to a permanent problem. It's the opposite. This woman's mom, very beautifully, Brittany Menard's mom, beautifully articulated why all of us should be rethinking our moral ambivalence about right to die. We have the technology in America to keep all of us alive for a lot longer than maybe we want to be kept alive. It's a mature discussion for us to have. All right, last topic you asked about, stress. Overwhelming stress. Finances are tough, my health is suffering accordingly, and the medications that I'm taking for that aren't working. I picked this as my last question for a reason. It is at the root, the big challenge we all face, but most of us don't want to think that stress is something we can alter all that much. But you can. And in fact, only you can. Now notice the question. She says, my medications are failing. Well, I don't want you using medications for stress. Too many people do that. And they use medications that actually don't work long term. The medications that we use for stress and depression are primarily designed to numb you to life. They don't deal with the problem. They numb you to life. The reason that you're feeling stress and depression is that your mind isn't happy with what's going on. And it wants you to change something. Change your relationships, your job. You gotta teach people how to treat you. You gotta actually go out there and do that. You know, you can change your finances, you gotta change. And so if you numb yourself to that discomfort, you won't change. And you're out there building up these big walls to protect you. Those walls are called cages. You're putting yourself in prison. And these pills only allow you to do that without feeling what's really happening. So I feel very strongly that to really deal with stress, we need to analyze it. This is called a Simon wheel, this image. Now you don't have to look at it too carefully, but there's three basic kinds of stress. There's fight, there's flight, right? And then there's freeze. I'm not gonna move. Three basic kinds of stress. This is actually a phone app now. They started using it in call centers to tell when people in the call center were getting anxious. I can analyze your voice and tell you more about your stress level than you ever imagined. There's 600 different kinds of stress responses, 600. They're all within that fight, flight, or freeze, but there's 600 different ways of doing it. These phone apps now, this one's called ShareCare, the phone app ShareCare. You can talk into the phone on an Android phone, and it will tell you how you felt while you were talking to your mom. And then you don't have to tell mom what you thought, but you'll actually see there what kind of stress you have. It'll put you, it's like a bullseye dart. It'll put you on there and say, well, you were angry and irritated, you're in the fight mode, and you have this much, and specifically you felt this. You'll see there, oh my goodness, that's really cool. Now that you understand it, you gotta fix it. So how do you fix it? Well, there's simple relaxation techniques. Easy one. I do this one all the time. I get a bottle of wine. You can drink the wine too, that would work. But without drinking the wine, get the cork, put it in your mouth, and relax this muscle. It's called the masseter muscle, the big muscle that controls the mandible to the upper jaw. You want to relax that muscle because it's the only joint in the body that actually disarticulates, that actually dislocates every time you move it. That's how you generate force to bite. So you're going to relax that muscle. I do this in the car all the time. I keep the cork in the ashtray. So I put it in my mouth, and the best part about this is when people driving by me, they don't bother me. No one's going to get in your way. The other thing is deep breathing. Take a deep breath, everybody. Deep breath in. When you take a deep breath in, put your hand in your stomach. Does it go in or out? Deep breath in. Stomach goes out, out. No, it's not supposed to go out. Yes, it is supposed to go out. I was just testing you. When you take a deep breath, I'll do it for you up here. Deep breath in, ready? This is how many of you do it. Okay? That's not a deep breath because that's using only the little muscles in your chest. Your stomach goes in, it's not supposed to. When you take a deep breath in, you're supposed to push your stomach out. Push the belly button out. When you push the belly button out, you leave room for the lungs to go down. So one more time, I know it's hard to do, I'm gonna count to 8. The first 4 seconds, you're gonna purposely exaggerate, push your belly button out, and then the next 4 seconds, as you expire the air, let the air come out, you're gonna actually pull your belly button towards your spine, okay? Deep breath in, 1, 2, 3, get the belly out, 4, let it ache in your xiphoid, ache up in here a little bit. Now relax, 5, 6, now pull your belly button in, 7, 8. That's the deep expiration. You want to do that. That's a deep breath. It's a very effective tool. You'll be sitting in a crowded board meeting with someone you don't even like. You want to go across and strangle them across the kitchen table. But instead, that's fine, JB.